Welcome to Lead Story here on CVM TV. My name is George Davis. On Tuesday's show, we had two medical practitioners with a combined almost 80 years in the public health business, decrying the state of the public health sector and saying that things really ought to change, even as I challenged them to tell me which period in Jamaica's history was it all hunky-dory in health, where everybody who wanted a bed could find one and everybody was pleased with the quality of service that they got at the public hospitals. Nevertheless, they maintain that things ought to be better given the weight of the financial input into operating the public health sector. As usual, we have a package at the top of the show to set the scene for the discussion, and then I'll introduce my guest, the Minister of Health and Wellness, Dr. Tufton.
The imagery at Wednesday's post-cabinet press briefing, a defiant minister with the words to match. Christopher Tufton on a somber war path, admitting his intention to control the narrative surrounding the performance of the health and wellness portfolio under his leadership. Placed in the firing line by critics, Dr. Tufton dismissed their assertions and warned it undermines the work of the civil servants employed to the sector. Leading the pack of critics are the tag team of Dr. Dayton Campbell, the General Secretary of the People's National Party, PNP, and Dr. Alfred Dawes, the party's spokesperson on health.
We know for a fact that many of these ventilators that were donated during COVID as a result of the efforts of the European Union and several private sector organization entities, as well as well-thinking Jamaicans, these ventilators are not in working order.
The opposition has clearly decided that their best hope for political office is to pursue what I will classify as a carpet bombing strategy. In other words, throw as much mud as you can imagine, as you can conjure up in your imagination, and hope that something will stick.
On Lead Story Tuesday, two medical professionals, Dr. Michael Abrahams and Dr. Paul Wright, also laying out a case Jamaica's health system is in disrepair. Although adopting a less political tone, accepting many of the said conditions have had a shelf life spanning administrations.
The Auditor General has been very, very busy since he's been Minister of Health.
Yes.
The ministry has been repeatedly flagged for hundreds of millions of dollars in situations where contracts were not put out to tender, where procurement procedures were not followed, where large amounts of money cannot be accounted for. You have the situation at Cornwall Regional where the budget started at about $2 billion and it was supposed to have been finished by 2020. Mm-hmm. It's now 2024. Mm-hmm. The budget is now about, I think, $21 billion, and it's still not finished.
They were pressed on whether the health ministry needs new leadership.
Does the Health and Wellness Ministry need new leadership?
There's no doubt in my mind.
Yes.
And it goes not only to the leadership,
yes,
it goes to the different boards that you are saying.
Yes.
They are too licky and afraid
yes,
to do the right
so
thing.
you're saying yes, and Dr. Abrams, you're saying yes as well?
Definitely. An overhaul.
An overhaul. The ministry needs an overhaul, starting with a change in leadership.
I think so, definitely.
Well, Dr. Tufton says the country's healthcare system is moving in the right direction. So, are the comments and accusations about the state of the healthcare system in Jamaica by the PNP and critics a misdiagnosis? Well, the doctor is here to lay out his case.
Thank you very much, Curtin. Jonathan Atkins preparing that nugget at the top. Minister, welcome to the program.
Thank you very much.
All right.
Good to be here.
Good. Let's start here. Mm-hmm. How many, if we go back to 2016, when the life of this two-term Wellness administration began, and you sat in this chair as health minister, how many doctors did you find in the system? How many are there on this day in sports?
Right. So first of all, I can't give you the exact number of doctors that were there. What I can say is that since that time, we have established as permanent positions an additional 1,500 posts for doctors. An additional 2,000 posts for nurses. In fairness, some were already there on contract,
yes,
but they didn't have the security of tenure.
Yes.
And that was an issue.
Yes.
And for retention purposes and greater security, we offered those positions. Now, we are in a process now of hiring filling those positions. And the reality is that it's not that easy because we do have a major migration problem.
Yes.
As a result, we have had to collaborate with other jurisdictions, Cuba being one, and we have since forged alliances with others. But we do have more doctors in the system now and nurses than 8 years ago.
Are we short of doctors and nurses?
It depends on how you approach shortage. In terms of registered nurses, RNs, which are the basic minimum requirement,
Yes.
we have, for the most part, enough of those.
Yes.
If you get into the critical care nurses, the specialist nurses,
Yes.
we do have a major shortage.
Yes.
And we have a shortage because we're not training enough when compared to those who leave. And part of that is a lack of clinical rotation space, the way the training is structured. Part of that is a lack of faculty, which is a global shortage. And so we have really been net suppliers to the international market for those positions. As a consequence, we do have a shortage in about 5 or 6 critical areas: operating theater, critical care, areas like nephrology. So those specialized nurses, which is why we have to forge alliances to try and bring some in or collaborate on expansion of training, which is why we have offered a $2.5 billion scholarship over 5 years.
Yeah. The issue of the state of the public health care system, as with almost everything in Jamaica, has taken a political slant. Those who are anti-wholeness administration say everything is wrong all at the same time. Those who are sympathetic to the administration say, but there's progress happening, right? As a minister, you are the man in charge. I ask you, do you believe that Jamaicans ought to expect a better public health care system for the billions that have been pumped into healthcare since you sat in the chair as Health and Wellness Minister?
Listen, I don't argue in extremes because I'm a realist. And I think it's important to be sincere about the state of play. If you ask me if the health system is better off today than it was 8 years ago, I will say absolutely yes. And I'll challenge anyone who has an alternative view. I saw your guess. And you know, sometimes people speak from a position of ignorance, because I heard some of the comments being made by the social commentator, which really is not factual. But we can get into that. So I do believe, based on what the government has spent, has committed to, I think some of the transformational changes that we have all hoped for, like digitization of patient records, the massive expansion of hospital build-out, whether it's Spanish Town, Western Child, or otherwise, which will lead to additional beds, additional operating theaters, and so on, that we are on a trajectory that we have never seen before. Now, are we there yet? I'm prepared to say not in all cases. Is there levels of dissatisfaction? Yes. But there are also significant levels of satisfaction. It's easy to be anecdotal based on the complaint of one person.
Yes.
And in fairness, we need to take every complaint seriously.
Yes.
But let me give you the macro numbers. On a given year, 3 million visits go to a health center or a hospital. 1.4 million to hospitals, 1.6 to health centers. 200,000 on average Jamaicans spend 5 days or less in a hospital for inpatient care. The complaint rate is probably less than 1%. Now, is it that some people leave, have a problem, and don't complain? You may have some of that. But the truth is, it only takes a few cases, and we must take all cases seriously, to generate a particular perception. The studies that we have done, in fact, the Public Sector Transformation Unit has done surveys to get the public's view on the state of healthcare. And those studies, those surveys have shown an improvement in public perception around what is being offered.
So you say all that to say, so you're saying, you're rebutting.
I am saying that...
But let me put this, let me put the question. You're saying that there's no truth to the claim that there are more people now who want hospital beds who can't get beds.
I am saying that's not true.
And you're saying...
I am saying, however, because again I say, this is always a moving target.
Yes.
If you look at the health profile of the population a decade ago and compare that with today, the reality is that the demands on the system are far greater, which is why it's so difficult to compare in periods of decades, for example. People are dying younger. premature mortality because of lifestyle diseases. People are getting sick earlier. Let me give you a classic case that is quite tangible. The numbers around the NHF prescription and drugs that they offer to the public,
Yes.
subsidized or free drugs.
Yes.
5 years ago, the National Health Fund was offering 1 million prescriptions to Jamaicans. This past year, they were providing 3 million prescriptions to Jamaicans. The NHF budget has more than doubled over the 8-year period. The government has provided the resources for that.
Yes.
We have added 5 additional sickness categories, persons who once could not benefit from the NHF, including subsidized prostate screening, the leading cause of cancer-related deaths in men, cervical cancer screening, a second leading cause of death in women, breast cancer being the first, and other cancers because it is one of the fastest sickness category in the country.
Yes.
Now, those are services that never existed before.
Yes.
They exist now.
But let me ask this before the break.
Sure.
Are there more people waiting to get critical surgery who can't get that surgery than ever before? In other words, before you took charge in 2016, the number of people, the waiting list for surgeries, is this waiting list shorter under your watch or longer than before?
So understand how surgeries work.
Yes.
Right? You have elective surgeries. This is surgeries that don't immediately cause
Yes.
serious damage or death.
Yes.
It could eventually, but not immediately.
Yes.
And so those are planned with dates. And then you have emergency surgeries. There is a case where a person could be set for a date for an operating theater at KPH, for example.
Yes.
And when they turn up the morning to get the surgery, 5 gunshot wounds come in.
Yes.
Or a heart attack victim.
Yes.
And they immediately gets pushed back. So depending on the surgery that you require, people still can have long waits. We introduced a program called Code Care,
Yes.
which has sought to clear up a number of those surgeries post-COVID, and have done well over 3,000, 2,000 plus of those long waits. For emergency surgeries, people get through immediately because it is emergency.
Hear you on that. We're talking to the Health and Wellness Minister, Dr. Tufton, responding to claims that he's presiding over a health system that's not fit for purpose. My producers say tough days for Tufton. I like the play on words. He is with me now, the Minister of Health and Wellness, Dr. Christopher Tufton. As a man who knows and understands the value of public relations and marketing, because people seem to think that that's a bad thing. But then the people who criticize PR use PR to criticize the PR. Well, anyway, that's another thing for another time. Why do you appear to be losing the PR battle about the true state of play at Cornwall Regional Hospital? Your critics keep saying you started something and told us it would cost $2 billion. Now it's $20 billion plus. It proves rank mismanagement and your unsuitability for the role. I wanted to respond.
You know what's interesting about Cornwall? There should be a case study. And we are going to do a write-up for how not to treat a critical piece of infrastructure. Those persons who make that comparison, it started with the opposition, and clearly some of the commentators have latched onto it, clearly don't understand the meaning of the difference between overrun and rescoping of a project. Cornwall Regional has a history. We had to find an alternative accommodation for 450 patients in beds because the hospital literally collapsed. Initially, it was a ventilation system, and we went ahead and costed out and got a ventilation system replacement. It morphed once you started to look at the facility into an electrical problem, a plumbing problem, a roofing problem, a compromised building, the base of the building, removing the chimney from the middle of the building, it's a Canadian design, and essentially turned out to becoming a totally renovated, where every single piece of equipment, whether it's the window, the door, or the diagnostic operating theaters, 7 of them will be in that building, are going to be totally new. So what the government decided to do was to move from a patched up renovation that eventually would then put us back to square one, which is what the opposition did. They ignored the ventilation issue for about 10 years, and the history is there to show, to essentially gutting the facility and saying, listen, let us construct a facility that can last for the next 50 years. So when I hear the conversation around 2 to 21 billion, first of all, it's not 21 because a lot of the money spent was to build out facilities around Cornwall. We converted the Mount Salem Clinic into the accident and emergency. We doubled the size of that. We built a new diagnostic center. We had to renovate the operating theaters, 4 of them at Falmouth to facilitate surgeries.
Yes.
So it is not that the main building got that amount, but the services of Cornwall had to be spread out. And so there's either a lack of understanding as to what transpired, or clearly some persons are wedded to this kind of mischief narrative. Now, we have a responsibility to get the public to understand, so I appreciate that we may need to keep repeating it, but that is the reality of Cornwall.
Your critics also say that you are shielding a permanent secretary who has presided over a situation where the Auditor General, through a performance audit, has found, well, here's the way I'm going to say it, has found missing funds.
Correct.
Money cannot be accounted for. Funds have been misappropriated. Hundreds of millions of dollars that could be put into the health system can't be accounted for, and you're shielding that man. Respond
This
to
is
that.
another narrative by the purveyors, by the opposition and their surrogates. I don't know why it is so difficult for intelligent people, some of the commentators that I witnessed earlier, to understand the difference between incomplete or unaudited books that have not been signed off on, as opposed to missing funds. There has been no discussion by anyone to suggest that funds have been missing. I don't need to protect the permanent secretary. He's the chief operating officer. He reports to Parliament. He's a creature of the Constitution. And the truth is, if he's in breach of anything, the system will take care of that, just as it would have me, frankly speaking, and of course the Prime Minister. But the reality is that this is a 10-year period, the appropriations books, including 3 years under the PNP, 2013 to 2016. In fact, the reason why we cannot sign off on those numbers is because the numbers under the 3 year of the PNP are the most difficult ones to complete, because during that period, whoever was in charge, some of those persons we can't find, some of them have migrated, some have died, they did not complete the books in terms of accounting for those projects. And we have to deal with the entire thing. That is one of the most substantial reasons why we have this incomplete books. There are other issues too. There is the PS has spoken about the Finman accounts coming out of the Ministry of Finance, which had some errors. But the reality is, this says nothing about missing funds. What it says is that there have been difficulties getting them signed off, largely because of incomplete information, primarily during the period of the People's National Party, between 2013 and 2016. Again, misinformation by those who may not understand what is happening, but pulling pieces of information to draw conclusions that are clearly faulty.
On your watch, how many of the island's primary healthcare facilities have this JLP administration improved from where you took it?
Dozens. I mean, I don't have the specific figure, but the last year when I spoke, this government had spent over 3 billion Jamaican dollars improving primary healthcare, health centers. We have 325 in the country, community health centers. We just announced in our budget $1 billion under a program called Operation Refresh, which is going to see many more, maybe about 50 or more, getting a facelift, because we are repositioning primary healthcare under a life stage approach, which will see more services being offered at the primary healthcare level in order to stop the crowding out of hospitals. And we can get into that. More doctors, more nurses, more services. So the truth is, we have renovated, retrofitted, built new health centers over the last 8 years than any other period over the last 20 years before that.
There's VAS, there are so many ministers in cabinet with big portfolios. You say that you are the victim of a, well, not victim, you are the subject of a coordinated attack by half of the shadow cabinet, you said on radio this morning. Why should we believe that that's
First
true?
of all, if it was me alone, it's neither here nor there. You know, I ultimately report to a cabinet. The chairman of that cabinet is the Honorable Prime Minister, but I also ultimately have a responsibility to the people of Jamaica to carry this portfolio. Contrary to what some have said, the reality is, for the most part, the people of Jamaica have given me an approval for what we're doing for the most part. I'm not saying we're perfect. I'm not saying we're perfect.
Yes.
But I go out a lot, and I've seen also the scientific studies around people's performance. And the truth is, we have not done badly. Now, I don't take credit for that alone. I attribute that to the 23,000 Jamaicans who are in public health. What irks me about the recent coordinated approach, which I classify as carpet bombing, which is burning down the house in an attempt to control the house, which is totally counterproductive, is that those spokespersons representing that organization and their surrogates have requested the resignation of the permanent secretary, the chief medical officer, two persons who played a pivotal role in the greatest pandemic that this world has seen.
But you would accept
and
that
on all accounts have done well.
But if you accept that, notwithstanding their efforts during COVID, if subsequent to that they're underperforming, then it's fair game to call them out.
The calling out of those plus the boards, the regional boards, have no substance to support it. Let's take the maternal mortality issue, which is what Bunting and his gang of spokespersons called out Wayne Chen about. He was intellectually dishonest in the use of statistics. We were looking at a 10-year period around maternal mortality. We put out the document, by the way, the ministry, when I tabled my report in Parliament. That document shows over 10 years, on average, over 100 deaths per 100,000 maternal mortality. I agree, during the COVID years, it showed over 200, but on average, over 100 plus. What he did was to take 1997, I believe, 1 year, which was an exceptionally good year. I think
meaning low.
26 deaths per 100,000. Compare that with the worst year of COVID and drew a conclusion that Wayne Chen and the board of the Southern Regional Authority should be fired because of their stewardship during that period. It is intellectually dishonest. I have no issues with him saying we need to do better on maternal mortality. In fact, he didn't have to say it because we said it. We've said it. We put it out in the open. We have announced a program to deal with it. So they're really repeating what we have said. But to take that extreme position is, to my mind, the sort of carpet bombing approach. But it is wrong.
But do you regret your narration around the reasons for the high maternal mortality rate, especially during COVID, which the PNP have interpreted to say you are blaming mothers for not seeking care in time, effectively blaming mothers for their own demise?
That's part of the grand strategy, the coordinated strategy. 6 spokespersons over 1 week, 10 releases. I've never seen a case where we have 6 spokespersons attacking public health. And I don't say me, public health. The Director General of the Pan American Health Organization, Dr. Barbosa, released a statement a few days ago where he called on the region of the Americas to take more action, more intense action to control maternal mortality. It's not a Jamaica problem. The reality is the only way to solve this problem is through collaboration between public health and families, mothers, expectant
But
mothers.
even as you say that, you're saying that if I pick a country at random from Latin America and the Caribbean and look at their maternal mortality rate in the period that you presented statistics for in your record, it will show a spike in the COVID period?
That is what PAHO has said. I have not looked at the data myself, but the words are there very clear, his quotes, all right? Now, the point I'm making is I never intended or insinuated that somehow it is the fault of mothers. The truth is public health has a responsibility. We all know that. So that's an extreme posture that has been taken deliberately for personal political gain. But the reality is that mothers and expectant mothers are also going to have to play a critical role in controlling the risk factors around giving birth. Part of the chronic disease profile of the population is that not just mothers, but all of us are more afflicted by hypertension, high blood pressure, diabetes, or sugar. Those are just 2 of the critical risk factors where it could influence the risk of them. Now, that has to be controlled, and it means going to the clinic every month.
Yeah, I'm out of time, Minister. I have to ask you this. When will the public see the administration, whichever administration it is, whether it's this one or another one, cut the ribbon on Cornwall Regional to look what we've spent billions on?
So yesterday I spoke to Western Child being next June.
Yes.
That's 12 months. Cornwall will be occupied partially during that period. So you're going to see a number of floors being occupied. Where we are now with Cornwall is that we're putting in the internals of the building. Before that time, it was about stripping down the building, pulling out everything, and literally reinforcing the structure. Bear in mind, by the way, because someone mentioned about finishing in 2021. There were 3 years of COVID when we could not do any work on Cornwall. And that's a very important point.
Hear you on that. You've heard the critics of the Health and Wellness Minister. You've heard from the Health and Wellness Minister yourself. My take is just to ask you, where do you think truth lies? You've read the figures presented. You've listened to the presentations. I'm sure you've digested the criticism and now you've had a chance to take in the truth. I won't distill it for you. I will leave you to make up your own mind about what state you think the Jamaican health system is in and if we're better off or worse off than any other period in your lived memory or even in your read experience. That's the lead story for this evening. I want to thank the Health and Wellness Minister, who is poor de combat. Well, he's not out of action through injury, but he is injured. He's still on the job. I want to thank him for making his way here today to speak to us and to address these very important issues. Thank you, Minister.
Thank you for having me.
That's the lead story.